It's Local Edition. I'm Brad Pomerantz. We thank you for joining us. Our guest is Mindy Marks. Professor Marks works at the University of California at Riverside, and she teaches economics specializing in healthcare, which is why we have you here today. Obviously, healthcare is a huge topic of discussion given President Obama's efforts. I want to talk to you about a few elements, and let's start right away with the issue of mandatory health insurance. It's been adopted in Massachusetts. Tell me what it is, what you think about it.
Okay. So currently in the United States, right, insurance isn't required. Even firms don't have to offer insurance to their workers. It's a voluntary decision. And this creates certain problems in the insurance market because you end up with something called sort of the last man uninsured. So you take someone like my brother, who is, what's David now, 30, and he's a young, healthy guy, and he doesn't make that much money, and so he doesn't buy insurance because he figures, you know, he's fine, and worst comes to worst, if something really bad happens, he'll go to the ER, he'll be taken care of. And so from my brother's point of view, this is a sensible enough thing to do, but the problem is that my brother is implicitly imposing costs on all the rest of us.
And what if he gets a serious illness?
Right, because if he actually goes to the hospital, they will treat him. The hospitals are required to stabilize patients, and he won't be able to pay those bills. And so the cost of those bills will get passed on to sort of everybody else in the society.
But with a mandatory insurance plan, what about those who can't afford it?
Yeah, well, so you would have to subsidize the plan for low-income people, right? And I think the current proposals that I've seen have sort of a sliding scale. So as you make more and more money, the amount of subsidy you get gets weakened.
So as you look at the proposals marching through Washington, does it appear that mandatory health insurance is going to make it out?
Gosh, I think so. I mean, I think there's a lot of initiative to try to increase coverage, to try to reduce the number of uninsured, and you know, I mean, this is sort of one of the easiest ways to do it, because if you just try to expand the individual programs, you're never going to cover everyone, because there'll be people who aren't eligible for, say, you expand Medicaid, but there'll be people who make too much money.
Do you feel as if insurance should continue to be linked to employment? I mean, so many of us get our insurance through our employers.
Yeah. The short answer would be no, but the long answer is that's going to be hard to disentangle. So the United States is sort of unique in bundling insurance to employment. No other nation does it that way.
Interesting.
And it's really kind of a historical artifact. It wasn't like there was a grand scheme 50 years ago where people said, well, we need a risk pool, so let's link it to the jobs. It sort of happened. Firms started to offer health insurance in World War II
as a benefit.
As a benefit to get around wage and price controls that were being imposed because people were worried about inflation. And then it's sort of taken off and had a life on its own. But linking insurance to employment has all sorts of problems. Like, for instance, if you lose your job, you lose your insurance coverage, and that's not really the idea of insurance. It'd be like saying, well, you have fire insurance, but if your house catches on fire, well, then then your insurance policy
and you probably need it most after you lose a job. Stress can cause illness and whatever it may be. What about taxing insurance plans? That is a big proposal that's floating through Washington.
Yeah, and this one's going to be, it's already getting a lot of political flack, right? So the way the current system works is if you get insurance through your firm, then implicitly it's subsidized, right? Because you don't pay income taxes, you don't pay payroll taxes, state, local, nothing. And so for high owners especially, this could be maybe a 40% discount. And so the plans are already subsidized, and there are a lot of economists out there who think that this leads people to overconsume, to buy far more generous policies than they would on their own.
In our final moments, what do you think?
So I think that we are going to see some sort of bill passed, and it's probably going to expand coverage, but it's not going to do a lot to tackle increasing costs, which are a big concern.
Professor Marks, I'm so glad you came. Thanks for joining us. For Local Edition, I'm Brad Pomerantz. Back to CNN HLN.